So as individuals, how do we protect ourselves and indeed our communities from the virus? Yvonne Yong has been delving into that topic for us. Tell us firstly, how does COVID-19 present?
Hi Bev. Well, it's important to recap here. COVID-19 is a coronavirus, much like SARS and MERS, which we've seen in previous years. It's not influenza or the flu. And from the little bit that we know about this new virus, we know that it shares similar symptoms to the flu. The World Health Organization outlines these symptoms as fever, followed by a dry cough, fatigue, and then a week or so after, shortness of breath, breathing difficulties, and some patients might need hospital treatment. And what we also do know is that the virus is spread via droplets through coughing or sneezing, as we've heard a lot about, and also that it can be transmitted between humans.
Indeed. So how should we be taking precautions now, or should we in fact be?
Well, it's important to note, as your previous guest mentioned as well, currently here in Australia, COVID-19 is not transmitted locally. So experts are saying we should just carry on with our lives as per normal. And if anything changes, the government will issue new advice. Here's what one expert had to say.
If Australia does have local transmission and our pandemic plan or emergency pandemic plan is activated, then the government will be giving advice, but the advice will be along the lines in affected regions for social distancing, so people to stay in as much as possible, to practice good hand hygiene whenever they've been out and potentially touching contaminated surfaces. There may or may not be advice to wear certain types of masks in certain situations. So those sorts of measures may be discussed, as well as if there is going to be a period of isolation for a week or two, there may be advice to maybe stock up on some food, groceries for pets, for yourself, and medications.
All right, so if that situation does arrive, what else can we then do to contain things?
Well, let's take a look at the standard recommendations by the WHO to reduce the risk of infection. As mentioned, we hear it so often, wash hands regularly. And this can be with soap and water or alcohol-based hand rub. Cover the nose and mouth with tissues, or as we all know, sneeze inside your elbow or cough. Thoroughly cooking meat and eggs. Avoid unprotected contact with live wild or farm animals. And that bit about hand washing too, it's so important, Bev. The WHO recommends that we do it regularly before, during and after food preparation, before we eat, after we go to the toilet, if we're caring for patients that we think might be infected with COVID-19, and also when handling animals or waste.
We tend to touch our faces hundreds of times a day, and if you put your hand on any surface that's contaminated, whether it's a grab handle in a bus or the back of a seat in a train or the table in the office tea room, if someone has coughed or sneezed on that surface and you touch it, you're at risk of contaminating yourself.
So we see so many people wandering around, and we know face masks are almost sold out globally. How effective is wearing a mask?
Well, the advice here is that if you are healthy, wear a mask only if you're taking care of a person with suspected infection. And you can wear a mask if you're coughing or sneezing. They're only effective, though, if you combine it with being vigilant about keeping those hands clean. That will only be effective if you do so. And if you really need to discuss with your doctor or health professional which kind of mask will be effective for you, and also educate yourself on how best to dispose of the masks safely. And Bev, I have to bring your attention to one infographic that has been circulating online. Now, this is the US
and
Centers...
on the comedy shows in the US.
I know. Can you see all those different facial hairstyles? Well, this is released by the US Centers for Disease Control and Prevention, and they're saying what kind of hairstyles are suitable for which kinds of respirators they're specifying. Didn't realise there were so many types of facial hairstyles, by the way, which is why I think it's so amusing. But actually, I just have to clarify for those people who might not be aware that this infographic was actually released in 2017 and not in response to COVID-19, as many people have assumed and found it quite amusing.
Indeed. Well, I'm still not kissing any men with beards at the moment. Okay, good to talk.
Neither am I.